Hello, my name is Marta Selman.
My name is Angela Corgi.
My name is Alvin Tan.
And today we're going to be talking to you about a new medication that you're starting, cyclophosphamide. This medication is used for multiple cancers, but today we're going to be talking about its use in breast cancer. Since you'll be taking this medication intravenously in the clinic, you do not have to worry about the storage and the handling of this medication. We do want to discuss with you some of the potential side effects of cyclophosphamide. However, we know that you're taking multiple medications and it can be overwhelming. So with this video, we hope to provide some information in a lighthearted and comedic manner so that you can remember some of the characteristics of cyclophosphamide. So today we are at the UConn Health Clinic and we have Alvin acting as the pharmacist.
Hello.
We have Myrna acting as the breast cancer patient.
Hello.
Okay, hi Myrna, how are you doing today?
I'm alright, how are you?
Doing alright. So I see that you're recently prescribed a new medication, cyclophosphamide.
Yes.
Is that correct?
Yeah.
Okay. So I'd like to take some time out of your day just to talk about a few side effects of the medication. So the first thing I'd like to mention is that cyclophosphamide, the medication itself, is actually a red drug. So that means that for the first 24 hours, you may notice that your urine or your sweat may be a little red.
Okay. What the Okay.
Yeah, so if this is only for 24 hours, like I said, then it's not that big of a concern. However, if symptoms like this persist for over 24 hours, it could be a concern for hemorrhagic cystitis. And hemorrhagic cystitis presents in many ways, one being, of course, the discoloration of your urine, but you can also see it with a fever or loss of bladder control, frequent urination, or an inability to urinate.
Okay.
So while hemorrhagic cystitis can seem a little bit scary at first, one way we have patients mitigate that risk is by drinking plenty of fluids. So from sun up to sundown, make sure you're drinking lots of water.
Okay.
Okay, so now that we have that covered, another side effect I'd like to talk to you about is alopecia. Do you know what that is?
No, I don't know what that is. What is it?
Yeah, so alopecia is actually just hair loss.
Okay. So is that going to be hair loss like anywhere on the body or in specific parts of the body?
You know, that's a great question. So alopecia in this case is only from hair loss from the top of your head.
Okay.
That's it.
Alright.
Okay, so another side effect is amenorrhea. Do you know what that is?
No, I don't.
Okay, so it's just a lack of a period.
Okay.
So on that note, another thing is infertility. That's another side effect that you could experience with this medication. So with infertility, one option that we have for our patients is actually freezing their eggs. And if this is something that you'd be interested in, we can have a conversation with your oncologist.
Okay.
So this therapeutic regimen is actually highly emetogenic. That means it causes a lot of nausea-induced vomiting.
Okay.
Grow up, will you? Oh, look at him now. Don't get so mad there around me.
Okay.
Yeah, so for your nausea-induced vomiting, we actually have something called quadruple therapy. And these medications are given to mitigate the risk of, events such as vomiting, right? And most of the medications are going to be given during the day of your therapy, your chemotherapy. However, we are going to be sending you home on a breakthrough medication to be used as needed whenever you feel nauseous.
Okay.
So the last side effect I'd like to mention is myelosuppression. This means that you're going to have low red blood cells, low platelets, and also a weakened immune system. So throughout the course of your therapy, we're going to be checking your platelet count, red blood cell count, and your white blood cell count. A few warning signs to look out for are darkening of the urine and yellowing of the skin and eyes. This may indicate liver problems. Secondly, as we mentioned with myelosuppression, you're going to have low platelets, low red blood cells. This may lead to chest pain, shortness of breath, swelling in the arms, ankles, legs, and this may indicate heart problems. And lastly, if you have changes in your ability to balance or focus, or loss of memory, this may indicate low sodium levels. All these problems you should tell your doctor about immediately.
Thanks so much for watching the video.